Hi everyone, Monica Moore. I'm one of the nurse practitioners and health coaches at RMA of Connecticut, and this edition of Ask Monica I'm super excited about. It's one of my favorite topics, which is what do fertility nurses do? How this came up was that I did a podcast about what fertility nurses do and how we can assist patients on infertility journeys, and a couple of my patients heard it and said, I didn't know you could do that, or I didn't realize till I came to RMA all the stuff that the nurses can do. So I thought we could talk about what that stuff is. If I have to use one word to describe what we do, who we are to our patients or clients, I would say we are your person. We are your advocate. We inform you and give you any information that you need. We're your support person. We're your liaison between you and the physician, between you and the embryology lab, between you and the finance department or non-clinical departments. We are specially trained, so when we go to nursing school, even when we get a master's in women's health, which I had, we don't really have reproductive endocrinology classes. So we are specially trained on the job. We all chose this particular niche, and we get advanced training and up-to-date training in it. We have constant research lunches. We go to conferences, and we have, actually I am in charge of, with one of the other nurses, the education for nurses, which is continual. And so we feel really strongly that we are very science-based and we are up to date on most of the, any of the relevant research. So what we do for you is we can answer medication questions. We can answer your treatment protocol questions. Many people, when they come in for an appointment or have a consult with their physician, are given a stepwise approach. Here's what we see with your results, here are your options, but they need a little bit of help discussing their options. We can help you with that. We can use your personal and individual views, maybe what your insurance coverage is, what your financial situation is, if you have any ethical constraints, and help you figure out what the best options are for you on that journey. We can map out your journey for you. We can go over what your steps are, what typical steps are. We can tell you what to anticipate for your office visits. When you come in the morning, sometimes we don't know what we don't know. We don't know what questions to ask. So being able to have somebody kind of write those down and say, here's what you should ask. Here's what you can expect at your next appointment. We can set up certain times to be able to talk to you. I always tell people that there may be a little bit of a sense of reactivity or helplessness in the cycle. You're kind of at the whim or mercy of what we're telling you to do or when to come in. But one thing you have control over is to tell us, or for us to make a plan. We can call you at a certain time. We can give you information in a certain way. Some people might prefer an email, so it's written down. Some people prefer a phone call. We have a lot of teachers that we work with, and they have a certain time frame that they can talk, that they have a free period. We can call you in that time frame. So there are some ways that we can communicate with you that make you feel like you have some semblance kind of control, some way of agency during the cycle. So we really want to get across to you that we are so much more than somebody that accompanies you in your ultrasound appointment. We probably do a lot more than nurses that you might see in another kind of freestanding office. We have a lot more autonomy, and we have a lot more information that makes us really confident in what we do and confident in answering your questions. So hope that's helpful. We will link to the podcast in the notes below, or we'll link to it on the Instagram page so that you can hear 45 minutes or 35 minutes, I think it is, of all the other great stuff that we do. But feel free, as always, to reach out to us with your questions, concerns, and challenge your nurse. Ask her a question today. I bet you she'll know the answer to it. So thanks again for tuning in.